Congressman Patrick J. Kennedy is serving his 7th term in Congress as representative of the 1st District of Rhode Island. Mr. Kennedy has received numerous awards for his advocacy on behalf of the mentally ill, including the Society for Neuroscience Public Service Award, the American Psychoanalytic Association President's Award, the American Psychiatric Association's Alliance Award, and the Depression and Bipolar Support Alliance Paul Wellstone Mental Health Award. It's a pleasure to serve with you, Patrick, as a colleague. We welcome you today, and we look forward to your statement.
Thank you, Chairman Andrews and Ranking Member Klein, and to my distinguished colleagues. Thank you all for the opportunity to invite me to testify today, and thank you for your commitment to ending insurance coverage discrimination against those with mental illness like myself. Let me begin by saying I suffer from the disease of alcoholism and addiction. I also suffer from bipolar disorder. I have, through the course of my life, had periods of time where I have had a mental obsession and physical compulsion to drink and use drugs in order to cope with a mental anguish that I have felt that today I no longer have to deal with through drinking and drugging, because I am a member of Congress and have access to the Federal Employees Health Benefit Plan, which has Parity. And what is before you today is a bill that will extend the same treatment coverage that I have had as a member of Congress to the rest of the American people, so that as a member of Congress, the reason that I'm able to be here today as a fully productive citizen, as opposed to someone who's still out in the society drinking and drugging and unproductive, as opposed to someone who's at work living a full and productive life. The reason, the difference is that I have treatment. And the difference between me and some other American who doesn't have that treatment is that they don't have that access. And what we need to do today is have a parity in this country so that millions of Americans who are still out there suffering from that same disease that I have, that physical illness, that they can get the same coverage that I have and that we all have as members of Congress. And so they can live productive lives. And if they live productive lives, they can be contributing members of society, as I hope that I am a contributing member of society. I know I could never have imagined myself, when I first ran for office, coming up here and saying I was an alcoholic and addict. I remember very clearly growing up in my family, whispering in my household, as my mother suffered tremendously from this disease of alcoholism. It was a shame growing up to have this disease because of the scourge and stigma in this country that this disease has been. But I think that it's coming out of the shadows now, and that this country has finally come to a reckoning that this is no longer an issue of a moral failing. No one can convince me from looking at what this disease has done to my mother, or what this disease has done to millions of Americans like her that I have witnessed, let alone what I have witnessed in my own personal life, that people have chosen this life voluntarily. No one voluntarily chooses to live the kind of sordid, painful, destructive life that people who are alcoholics and addicts, or people who are depressed, or people who are suffering from schizophrenia or bipolar disorder, any number of mental illnesses, obsessive-compulsive disorder, any one of those illnesses, no one can convince me that that is a voluntary choice on their part. And essentially that is what those who on the other side of this debate would have you believe. That this is a non-illness, that this is something that is non-physical, because if it were non-physical, then they could control it. And that is essentially what they would have you suppose, because if you were to believe that, then there wouldn't be any need for there to be insurance. But we know otherwise. The insurance system cannot hide the fact that brain science tells us otherwise. We have pictures. Modern science shows us these pictures that are clear as a bell, that the brain is a physical organ. And you cannot take a picture of the brain and look and say that the insurance companies can cover brain diseases like Parkinson's that affect the motor cortex and the basal ganglia and the sensory cortex and the thalamus, and then other brain diseases like depression, which affect the limbic cortex and the hypothalamus and the frontal cortex and the hippocampus, and they don't get covered, and yet they're 2 or 3 centimeters away. How can you justify 80% insurance coverage for one part of the brain and 20% insurance coverage for 2 centimeters away, or 0 insurance coverage for 2 centimeters away? How in the world can you explain that? Or you can say, well, no, sorry, as Mr. Klein said, we want to have the Senate language for the second part of the brain, but we want the current system of health insurance for the first part of the brain. It doesn't work. It's totally unjustifiable. Would you say the same with someone with cancer? Are you going to play with someone's life who has cancer that way? You take someone from your family who has a disease of cancer or diabetes, and you exchange that person's life and put in place mental illness and say that you're ready to bargain their life away, and answer that question, then I'll be happy to sit back and let you move on with your argument. But until you can honestly look me in the face and say that you're willing to put in place and substitute a person with cancer for that argument, or diabetes with that argument, or cardiovascular disease in that argument is specious, because otherwise it doesn't wash, frankly. This is a civil rights issue at its core. No one asked to have this disease. You're born with it. You have certain triggers through your environment that set it off. We're going to find all these things out in the years to come through genomics and personal health medicine. And we're going to have great revolutionary science help to solve many of these problems. But Mr. Chairman and Ranking Member Klein, if we don't move now, we're going to cost millions of Americans their lives. 34 million Americans, 34,000 Americans take their lives every year to suicide. That's twice the rate of homicide. Think of all the people that are killed by murder in this country, and think the fact that you multiply that 2 times, and that is how many people successfully take their own lives. That is a disgrace to this country. Think about the fact that the largest mental health institution in this country is our jail system. What an indictment on this country. And think about the fact that millions of Americans are not living up to their full potential, all because we have a discriminatory insurance system that continues to say that people are not living up to their full potential because we're not acknowledging this illness. I will say, but for the work of Paul Wellstone and Rosalind Carter, the former First Lady, who has been working on this issue for decades, and for Jim Ramstad, we would not have come as far as we have. And I just want to say, today I am standing on the shoulders of giants. And Jim Ramstad is with us in spirit. He has been absolutely no better champion for this cause than Jim Ramstad. And I am so honored to be his partner in this effort, and a fellow in the road to recovery. And I also want to say to David Wellstone, who's here on behalf of his father's legacy, what an honor it is to be joining him. He has done such a fantastic job in carrying on his dad's legacy. And to the former First Lady, she has dedicated her life to this issue. And the fact that she has done so with such compassion has been so moving to all of us. And I want to thank her personally for all of her great work on this issue. And for everybody in this today who's working on this issue, I want to thank them as well. And thank you, Mr. Chairman, for the time.